Great. Good afternoon, morning and evening, wherever you may be in the world. Welcome to the launch of the Lancet's third physical activity series on the eve of the world's biggest sporting event, the Tokyo Olympics and Paralympics, though somewhat worryingly overshadowed yet again by the COVID pandemic. My name is Pam and I'm an editor at The Lancet and have been the editorial lead on all three physical activity series since 2012. It's a topic very close to my heart. I'm delighted to be co-chairing today's webinar with Melody Ding, Associate Professor from the University of Sydney, Australia, and to have the participation of the lead authors from the series and other experts. This webinar will be recorded and available on demand sometime tomorrow, and you'll all be notified of that. So, the series has just gone live, so please do visit the Lancet website to access the papers, the comments, and the podcasts. We also want to engage you as an audience. I thought it would be interesting to have a poll in the webinar to see how physically active you all are. I suspect with this audience there might be a bit of preaching to the converted, but nevertheless, the three questions I'm going to scroll through now. So please do answer honestly. There'll also be time for questions at the end for our presenters. This slide here just gives you an overview of what you're going to be hearing today. We're very fortunate to have the lead authors from each of the papers and from the commentaries, and also experts external to the series who are going to and tell us about the work of the work that's going on in the field more broadly. For the next 75 minutes. And we're going to start with the poll. So here's the first of the three questions. Please do respond right now. I'm going to give you about 30 seconds and I'll see at the bottom how many of you are responding and then stop when I have a nice amount of people. So I'll read the questions. Why are you physically active? You've got health reasons, makes you feel good, social reasons, good for the environment, or you're just not physically active, or you're all of them. Come on, let's see if we can get it to 132 it's jumped to, great. 153. Let's see if we can get it to at least 2/3. Oh, lots of people. Right, okay, well, I'm going to stop there, but because I've got two more questions and we've got to get going, unfortunately. But thank you for those of who've responded, and we'll reflect on those results at the end. Right, next question. Do you do the recommended minimum 150 to 300 minutes of moderate to vigorous intensity aerobic physical activity throughout the week? Again, options are yes. The other option, less than the minimum, sometimes, rarely, never. Okay, great. Well, we've got a good percentage of respondents there, so I'm going to move to the last one. And here we go. If you are unable to be physically active in your daily life, is that because, one, no time, too busy, little or no access to sport, leisure environments, you don't really enjoy it, you're not bothered and don't really think about being physically active in your everyday life, please respond. Oh, fewer people responding to this. Is that because you're all physically active? Let's get it to just a couple more seconds. Great. Okay, well, thank you very much for those of you who are able to respond, and we'll reflect on the results at the end. So I've shown you the agenda, and I'm just now going to hand over to Melody Ding to say a few words about this series. Melody was very heavily involved and also led the 2016 series. Melody.
Greetings, everyone, from lockdown Sydney to all corners of the world. I'm speaking here from the land of Gallico people, and it's my absolute pleasure and excitement to introduce the Lancet Series 2021. I just want to give you guys a quick statistics about the series. What you're reading right now and what you're hearing represents more than 4 years of work from the authors. And it's not just for ordinary years, especially in the last year and a half, when with the most intense bit of the work happened, a lot of our authors were working under really, really special circumstances with the tiny dining tables in the kitchens, with children running around in the background, a dog on the lap, or very tired eyes after having to switch teaching from in-person to online overnight. So there was a lot of challenges, but there was a lot of resilience and persistence from this team. And I'm just so pleased to see everything coming to fruition. And this is the third series, as Pam just mentioned. Who said the sequels are not as good as the original? So in this series, we have 3 papers, and these 3 papers pick up on the special populations that we didn't pay enough attention to in previous series. These include 1.5 billion people in the world living with disabilities and 1.7 billion adolescents. And last but not least, we go back to where we started, which is the Olympics, which inspired the first series. The last year and a half has been truly special and challenging time for all of us. With border closures and lockdowns, the distance between us seems to be farther than ever. But with this one amazing team, with this shared common goal for promoting physical activity in the world for better health, we have put this through, and I really want to congratulate all 35 authors from 17 countries and 6 continents, everywhere except for Antarctica. And especially in this series, we have 3 papers and 2 comments, and out of the 5, 4 of them were led by our outstanding female researchers. So I just really want to applaud to the women here. And now, I cannot wait to introduce our first speaker, Dr. Esther Fonsoy, to talk about physical activity in the adolescent.
Thank you for that introduction, and I'm really pleased to be presenting on our paper today on behalf of the international team of researchers that contributed to it. So 10 to 24-year-olds make up 24% of the world's population, and over half of them are now living in multi-burden countries where they face a triple burden of infectious disease, violence and injury, and non-communicable diseases. We know that investing in adolescent health can yield triple benefits now into adulthood, but also for the next generation. However, physical activity in adolescence appears to be understudied, both in the adolescent health, but also in the physical activity research field. And this paper aims to bring it to the forefront. Our paper captures a period in a young person's life when significant transitions in responsibilities and lifestyles happen. This is not only when they mature and become adults, but also when they start relationships and maybe a family. They move into higher education, maybe start a job, maybe they stay unemployed, they might move out of the family home. Considering ways of promoting physical activity in such a changing demographic is really challenging. The evidence presented in this paper is based on 6 pieces of work. 2 primary analyses on physical activity behaviours in adolescents, 2 systematic literature reviews on the association between physical activity in adolescence and cardiometabolic and mental health outcomes later, an umbrella review on the determinants of adolescent physical activity, and a second umbrella review on the effectiveness of interventions to promote physical activity in adolescents. So we know from surveys that 80% of adolescents globally do not meet the WHO guidelines of 60 minutes of physical activity per day. This paper adds objectively measured accelerometry data shown on the bottom left of this slide. This shows that physical activity declines steeply during adolescence until the start of early adulthood, when it levels off. This demonstrates the enormous potential of physical activity promotion in the adolescent period. The WHO also recommends that children and adults should limit their time spent sitting. In this paper, we show that 25% of 11 to 17-year-olds sit more than 3 or more hours per day during their leisure. Over half of them spend 2 or more hours per day watching television on weekdays, and nearly half of them spend 2 hours or more per day playing computer games. We did not observe any clear variation in these behaviours by country-level income. However, while in high-income countries it tends to be those from low socioeconomic backgrounds that sit most, in low to middle-income settings it tends to be those from higher socioeconomic backgrounds that sit most. And we need to take this global variation into account when we're thinking about physical activity promotion in adolescents. Based on the 2 systematic literature reviews we conducted, we conclude that adolescent physical inactivity likely contributes to key global health problems, including cardiometabolic and mental health disorders, but that the evidence is generally quite weak. Importantly, obesity and mental health problems may become additional drivers for physical inactivity, further increasing the risk of morbidity and mortality later in life. Based on the evidence on the determinants and interventions, the paper identifies solutions to reduce adolescent physical inactivity within 3 key areas of the adolescent physical activity system. It's within schools, the social digital environments, and urban environments. Schools are particularly important settings for promoting physical activity. The evidence shown in this paper shows that school-based efforts, however, have been largely unsuccessful. This is likely due in part to issues with successfully implementing interventions in the school setting. There is a continued need for sustained implementation of multi-component programs in school, but these need to align with the priorities of the schools and the adolescents themselves. And schools need context-specific support to ensure these programs can be implemented effectively and sustainably. It is important to highlight that this evidence base is largely limited to research in high-income countries and in younger adolescents, and work is urgently needed to address this imbalance. While schools remain a very important setting for physical activity promotion, many adolescents across the globe are not in education. For example, over 1/3 of 15 to 17-year-olds are not in school, and there's substantial global variation in this figure. Considering ways of promoting physical activity outside of the school setting is therefore critical for this age group. The evidence emphasizes the importance of social support from parents and from peers for higher physical activity levels, but we didn't identify any review-level evidence to demonstrate any effectiveness of interventions specifically targeting elements of social support. We did, however, find evidence for the potential of e-health interventions in promoting physical activity in adolescents, which may be an attractive option across a wide range of settings. More than half of the world's population currently lives in urban environments. Changing the urban environment is increasingly recognized as a critical and upstream strategy to tackling population-level inactivity. We use global data to establish the prevalence of active travel to show and show that up to 48% of school-attending adolescents never walk to school. This not only has consequences for their physical activity, but also for air pollution and congestion. An activity-friendly environment that promotes activity for adolescents likely differs from one that promotes activity in children or adults. The review-level evidence suggested that multi-purpose environments appear most important for adolescent physical activity and should be promoted. Multi-purpose environments are those that, for example, promote both play and walking and encourage a wide range of activities. Finally, I'd like to thank my co-authors and all others that contributed to this paper, and I thank you for listening to my presentation.
Kathleen, are you there?
Yes, good morning. Thank you for that introduction. I'd first like to acknowledge my international team of co-authors and the research assistants who supported us. I also want to acknowledge that I am delivering this presentation from the University of British Columbia's Okanagan campus, which is situated on the traditional, ancestral, and unceded territory of the Syilx Okanagan peoples, and I'm a grateful visitor on these beautiful lands. It's estimated that 1.5 billion people live with a disability that impacts their daily lives. These populations are terribly underserved and understudied. Compared to the general population, people with disabilities are at greater risk of developing chronic conditions such as diabetes and cardiovascular disease. They face greater barriers to accessing health care. They have higher rates of health compromising behaviors such as smoking and poor nutrition, and they're less likely to receive health promotion and disease prevention services. And while people with disabilities comprise about 15% of the world's population, over the last 20 years, just 0.3% of papers published in the world's leading medical journals have addressed the health of people living with disabilities. Over the next few minutes, I will provide a global perspective on disability and physical activity participation, highlighting research gaps, challenges and priorities, and finishing with some calls to action. Starting with the epidemiology, people living with disabilities are 16 to 62% less likely to meet physical activity guidelines compared to the general population. And you might be wondering why that estimate has such a huge range. Unlike in the general population, for whom we have reams of national and international population-level physical activity data, for disability populations, these 7 lines of data are pretty much all we have. That's because having a disability is typically an exclusion criteria for participating in population-level physical activity surveillance systems. As a result, we have almost no data from high-income countries and literally no data from low and middle-income countries. And in the data sets we do have, different definitions of disability and measures of physical activity have been used, making for the inconsistent estimates. Based on our systematic review, there is, however, consistent evidence from meta-analyses that physical activity leads to improvements in cardiorespiratory and musculoskeletal fitness, psychosocial well-being, and cognitive function in people living with disabilities. But unlike in the general population, In disability populations, there have been virtually no studies of the effects of physical activity on the risk for chronic diseases and few adequately powered studies. Of note, in most of the studies included in the meta-analyses, participants were required to do less than 150 minutes per week of aerobic activity. On the one hand, these relatively lower levels of activity might explain why there were mostly non-significant effects for the cardiometabolic outcomes, but on the other hand, the consistent significant effects for the other three outcome categories show that people living with disabilities can achieve substantial benefits from physical activity prescribed below the 150-minute per week guideline, indicating that inactive people can achieve big benefits from small increases in physical activity. We also know that people living with disabilities face extensive barriers to physical activity participation. Our review showed these barriers at all levels of a social ecological model. Extensive research has documented factors related to physical activity for people with disabilities living in high-income countries, but we have almost no data from low and middle-income countries and few studies that have tested which factors are the strongest determinants of physical activity participation. The number and range of barriers attest to the need for multi-level intervention approaches. To date, virtually all of the intervention research has targeted intrapersonal or interpersonal level factors and has been conducted in high-income countries. In our review of meta-analyses, these interventions have been shown to consistently, significantly increase the amount of physical activity performed by people with physical disabilities, but less so in people with intellectual disabilities. Once again, we don't have any studies from low or middle-income countries, and the interventions thus far have focused on a narrow range of disability populations and intervention types. But from these studies, we do know that effective interventions have a theoretical basis and employ behavior change techniques. I think it's important to emphasize that efforts to design interventions to make physical activity participation easier for people with disabilities, it isn't just a nice thing we should be trying to do. Rather, it's a human rights issue. Various international policies and treaties recognize the rights of people with disabilities to participate in physical activity on an equal basis with others. But much more work needs to be done to put these policies into practice. Furthermore, using participation in international disability sporting events as an indicator, this map shows the tremendous disparities in physical activity participation between high versus low and middle-income countries. Globally, we need action plans empowering people living with disabilities to participate. Ableism, which is idealism and favoritism of able-bodiedness, must be challenged and prevented. And people with disabilities must be equal partners in the co-creation of new research knowledge and policies. In summary, physical activity for people living with disabilities is an issue that demands better evidence, surveillance, practice, respect, and value. I leave you with 3 global calls to action. First, accurate population-level physical activity estimates are the cornerstone of international physical activity action plans. We need coordinated systems to adequately capture physical activity participation levels at national and international levels. Second, we must put an end to the exclusionary scientific practices that have excluded people living with disabilities from population-level studies of physical activity, morbidity, and mortality. And third, we must ensure that policies and action plans are adequately resourced and enforced to advance the fundamental rights of people with disabilities to fully participate in physical activity. Thank you.
Thank you very much, Kathleen, for that very enlightening talk. The next speaker is Adrian Bauman. Adrian is the Emeritus Professor of Public Health at the University of Sydney, Australia, and we'll be talking about the Olympic legacy. Adrian.
Good evening, everyone, and it's a pleasure to be here. 20 hours from now, the Tokyo Games will launch, and there'll be lots of excitement and lots of interest. It is under rather constrained circumstances because of the global pandemic of COVID-19, but still it's an exciting time just tomorrow or the day after, depending on which day you're in at the moment. But all the Olympic Games have legacies. The legacies that Olympic Games usually leave are transportation systems, urban infrastructure, sometimes increased tourism, sometimes economic growth, sometimes new housing developments. There are several things that legacies that Olympics can leave, but can physical activity be one of them? We know that physical inactivity is a major problem globally, and rates of physical activity haven't changed very much. So we set out to explore the Olympics and their potential for a public health lens on physical activity. First, I must acknowledge my excellent collaborative colleagues who worked with me as a team on this: Massa, Melody, Karen, Pedro, Neve, Rodrigo, and Rick, and they were an absolute pleasure to work with and contributed over the last 18 months. The problem with physical inactivity is that it's what is described as a wicked problem. That means there isn't a single solution. There isn't one single thing you can do. There is the excellent Global Action Plan on Physical Activity that WHO has launched, which underpins a lot of the global thinking on physical activity. There were the 7 best investments, now updated by the International Society for Physical Activity and Health, to be the 8 best investments that show what works: urban design, healthcare, mass media campaigns, sport, workplace, community programs, school and active travel. But we really need to be taking a systems approach and doing all or many of these things and additional things as well. And it's in this additional things that the Olympics fits as one of the things that we might consider. So what did we do? We did 3 pieces of research work to try and understand the potential. Firstly, we looked at the Olympic bid documents dating back 25, 30 years to look at each bid document in detail to work out what the candidate cities said they would offer. Now, the International Olympic Committee Games report in 2001 said that they should all collect community data on community sport. And since 2007, almost all the bids have been mentioning the need to build in physical activity promotion and sport promotion into their Olympic thinking and Olympic bid. So really it was part of the bids. The next thing we did was we looked at, well, is there evidence for trends in physical activity or sport participation in population studies, representative samples from Olympic cities? And I'll show you just a fraction of our work. We looked at all the recent Olympic Games since 1996, and we plotted serial population surveys on physical activity or sport. See that for the most part, for Salt Lake City, for London, and for Rio, around the Olympics a couple of years before and a couple of years afterwards is fairly flat. The only exception is Beijing, that really had a national education and physical fitness program implemented nationwide around the time of the Olympics. On the right-hand side, you can see the relative change, and the relative change compared to the weighted mean average across a few years before the Olympics to after the Olympics. And if you look at the diamonds in blue or the orange circles, there isn't really any change except for Beijing, which did show an increase post-Olympics compared to pre-Olympics. So in general, there isn't much evidence that the population level really changes in the years following the Olympics. The trickle-down hypothesis is not supported. We also looked at Google Trends and did some modeling to see whether there was any change in community interest around the Games. And here you can see on the left-hand side, there is a huge increase in the word Olympic around the Games, a gradual increase on the right-hand side in searches around the London Olympics for the term exercise. So people were interested in exercise, but not changing their physical activity levels, as we saw in the previous graph. So we saw this in the Sydney 2000 Olympics that we evaluated. There was an increase in intention to be active, but no change in reported physical activity. So this really means that the community can be interested, possibly motivated, but not changing their physical activity levels because we're not actually getting things organized and coordinated. So what would we need to do? What we need to do is to integrate physical activity planning alongside Olympic planning. After the successful bid in yellow, the pre-Games years will involve partnerships between the host city, the Sport and Olympic Committee, and public health and physical activity promotion, exercise scientists, community programs. Around the Olympics, you need to have a range of community sport programs and physical activity programs for the general community, and especially following today's lecture, adolescents and disabled people. You need mass media campaigns, mass communications, and you need subsequent post-Olympic community use of Olympic facilities. This integrated approach is a multi-year strategic planning exercise, and that's the way we can get physical activity to be considered as part of the Olympics. Not just the Olympics. We can do this for mass events, European and South American and African football competitions, Wimbledon tennis, or the major sporting events that we have could also have a physical activity promotional element if we work together. So what we conclude is that physical activity really could add to the other Olympic legacies, but doesn't yet do so. Other mass events could also contribute to population levels of physical activity. Olympic bid documents are now mentioning physical activity. It's seen as important. But population levels of physical activity and sport participation mostly show little change immediately before to after the most recent Olympic Games. And we need careful pre- and peri-Olympic partnerships with all the regional agencies that can make populations contribute to sport to implement those programs and do it in a more coordinated way.
Thank you very much, Adrian. Andrea, your turn.
Thanks, Mel. Good morning, everyone. Thank you very much for the invitation. I'm pleased to be part of the launch of this physical activity series. I'll be talking today about global physical activity monitoring and the COVID-19 pandemic. So as many of you may know, the Global Observatory for Physical Activity is a direct product from the first Lancet Physical Activity series, and it is a successful case of how the series has a global impact. GoPA was established 9 years ago in 2012 to turn physical activity information into meaningful public health action to initiate or improve and increase research capacity, surveillance systems, and policy making in order to increase physical activity levels worldwide. GoPA periodically develops new indicators along with the policy, surveillance, and research core indicators, and this is relevant to the current global public health context, and this is also of interest for researchers and policymakers. We now have 2 sets of national physical activity profiles, the country cards, that were launched in 2015 and 2021. These country cards cover 76% of the countries and 90% of the world's population. Therefore, GoPA is an independent evidence and local representativeness, representatives-based surveillance system. Since the launch in 2012, GoPA has had a role in tracking progress of physical activity prevalence and related indicators worldwide, also facilitating evidence-based physical activity promotion building on international guidelines and on the WHO GAPA, the Global Action Plan on Physical Activity and Health, also supporting global physical activity advocacy to increase physical activity in the public health agenda. Since 2020, GoPA has had a role in monitoring the effects of the COVID-19 pandemic on physical activity and vice versa in order to promote good public health practice and to inform how this catastrophic pandemic has affected physical activity levels worldwide. So when looking at the evidence about the effects of the COVID-19 pandemic on physical activity, we know that there is evidence that the COVID-19 pandemic restrictions to limit the spread of the virus had detrimental impacts on physical activity levels globally. Most studies described a significant decrease both in self-reported and objectively measured physical activity, along with an increase in sedentary behavior, regardless of age, health status, or geographic location. When we compare pre-COVID periods, COVID lockdowns, and post-COVID peaks periods. It is important to mention here that there is a limitation because there is highly variable measurement methods. The other thing is that we still do not know the long-term health effects of this worldwide decrease in physical activity, and this remains to be determined. When you look at the effects of physical inactivity in the NCD's rise, we all know that physical inactivity is foundational for NCD's increase worldwide, and it is very unfortunate that NCDs have collided with the COVID-19 pandemic. Physical activity is very important during the COVID-19 pandemic because it not only enhances the immune function, it also speeds up recovery from infection and also improves response to vaccination, as some studies have showed. Also, it is very important because it prevents severe COVID-19 outcomes defined by hospitalization, intensive care unit admission, or death. For example, studies from the US show that COVID-19 patients who did not meet the physical activity guidelines prior to diagnosis were 2.5 times more likely to die when compared with patients who met the recommendation before the diagnosis. Authors mentioned that physical activity is one of the biggest risk factors for severe COVID-19 outcomes outside advanced age and history of organ transplant. The COVID-19 pandemic continues to advance, and reaching high global vaccination coverages will take time. So we recommend to strengthen public health messages to reflect evidence of physical activity's role in protecting against infectious diseases as well as NCDs, and to implement effective public health strategies and global action guided by the WHO Global Action Plan on Physical Activity and Health to promote physical activity as a means to reduce not only health inequities, but also morbidity and mortality, not only from COVID-19, but also from the NCDs and from physical inactivity. Thank you very much.
Great. Thank you, Andrea. Just before we continue, just a reminder, we do have a Q&A time at the end, so please do think up some questions for the presenters. There's a few already that we can see, which is great. Yeah, just to say, if you do have questions for the presenters, now is the time to think them up, and you could just drop them into the chat box. Thanks. Right, so our next speaker is Alejandra Yaruga, who is the chair of the Department of Physical Activity and Healthy Lifestyles in Mexico, and who will be talking about the other co-benefit of physical activity, which is active transport and urban design, and the scaling up and what impact that the pandemic has had on that. Alejandra.
Thank you for the introduction, Pam, and it's a pleasure to be here in the launch of the 2021 Physical Activity Series. Before I start, I would like to acknowledge my co-authors of this comment Vicky Lambert, Jenna Panther, Clover Moore, and Deborah Salvo. As we know, active transportation systems and active urban design are among the best investments for encouraging physical activity at scale. In the COVID-19 pandemic, cycling became an efficient and safe urban mobility option for many city dwellers who had access to high-quality urban infrastructure. Also, public open spaces have been essential for safe recreational physical activity and social interaction. However, this was not the reality for all. During the pandemic, many people's only option was to continue to use crowded public transportation systems. Indeed, residents of low and middle-income country cities have faced an urban penalty because poverty, overcrowding, and inequitable access to infrastructure compromise their adherence to physical distancing guidelines. Encouragingly, some cities responded to this situation by implementing rapid, large-scale urban transformations to increase access to open public open spaces and active transportation infrastructure. This was the case of Sydney, Australia, and Mexico City in Mexico. In both cities, pop-up cycle lanes were rolled out since mid-2020, and plans to maintain the new cycling infrastructure permanently or develop acceptable long-term alternatives have been announced. As Adrian Bowman mentioned, with the Tokyo Olympic Games, the world has turned its attention to elite sports for a few weeks. But the Olympic Games alone do not improve population levels of physical activity. We need transformational approaches that shift the focus away from individual responsibility and towards large-scale, systems-oriented strategies for physical activity promotion. Although many challenges for implementing these approaches remain, this can be overcome through coordinated actions across sectors and levels of government, and by leveraging the multiple benefits of physical activity promotion for human and planetary health. Systems-oriented actions taken in Mexico City and Sydney during the COVID-19 pandemic show how bold political leadership, along with social mobilization, can make important strides towards achieving global physical activity targets. These approaches must be prioritized in all settings for meeting sustainable development goals across the world. Thank you.
Great. Thank you so much, Alejandra. And finally, we have Jasper Schippergin, the president of the International Society for the Physical Activity and Health, who's based in Denmark. And Jasper is the head of the society, and he was very kind in supporting our first meeting, in fact, our first face-to-face meeting with the authors when we began the series a couple of years ago now, actually. It seems just yesterday, but it actually is 2 years ago. So Jasper will be presenting some of his reflections on the series, and also, as his title suggests, how do we invest in physical activity and how do we take the field forward? Jasper.
Thank you very much for that introduction, Pam. And of course, thank you all to all the speakers for their excellent presentations and very, very interesting papers to read. I've probably been among the first to be able to read through all the papers, and that has been a true pleasure. And ISPA, as an international society, we're very much interested in making physical activity a key item on the global public health agenda. And I think that the Lancet series, that this third series of papers that we're hearing about today, is a great example of how the Lancet series can be and has been very much part of setting this global agenda. So what you see here on the slide are the two covers from the 2012 and 2016 series on physical activity, as well as the recent WHO guidelines on physical activity and sedentary behavior. And I think these three publications in the past decade are all three really key publications that everyone should know about. And I very much hope that this third series on physical activity will again be one of these key publications that we learn from and can build on when we move towards the future. So if I'm reflecting on these papers, what have I learned from these papers? So as we also heard in the introduction, this was a series very much focused on those population groups that we did not address as much in detail in the first two series. So we heard about adolescents and why it is so crucial to invest in that age group, where the triple benefits of having more physical activity, it can have an impact now, it can have an impact in adulthood, and it can have an impact for future generations. How do we do that? We've heard Esther talk about some promising solutions in school settings, but also I think that is really important, and to me at least was very much an eye-opener, that we need to think about interventions for adolescents in non-school contexts. There are a lot of adolescents that are not attending school anymore. How do we reach them? What do we do there? I think that is crucial. The other very crucial thing I picked up from Esther's presentation, from her excellent paper, is that we need to think about activity-friendly environment for adolescents, which are probably different than activity-friendly environments for children or for adults. So what is it specifically in the environment that is conducive for physical activity for adolescents? Something to work on in the future. We heard an excellent presentation and a really great paper from Kathleen and her colleagues about people living with disabilities. They're less active, even though that the data that is available is very limited. It's quite clear they're less active and probably more at risk than the general population. And for this population, even more so, every move counts. Even a small increase in physical activity can already have a positive benefit. What I think was the key message to me, at least, in Kathleen's presentation was that we need to stop excluding people living with disabilities from our general interventions, from our general population surveys. They are as much part of the general population as those that are not living with disabilities. It's a very, very large group of people that we need to spend a lot more time both studying and working with in the future. Adrian was talking about the Olympic Games, and unfortunately, there was no trickle-down effect that Adrian and his colleagues could find after the Olympics. I think that is definitely one of the things that the Tokyo Olympics and those Olympics coming after that will need to work with. And we heard Adrian suggesting that there might be other mass sport events that again can be used as a catalyst for general physical activity improvement, but it doesn't happen on its own. It needs, if we want to use these mass events, we need to have them accompanied by more general plans of actions for how do we also activate the general population while there is much more focus on physical activity worldwide. In the two excellent commentaries, we've been able to read about, okay, well, how does COVID-19, how has that impacted physical activity behavior? And potentially, at least we've seen that in some of the higher income countries and cities, some of the changes that happened partly due to COVID-19 in our urban infrastructure, they might actually be here to stay and might actually be very conducive for more physical activity, active transportation, and active urban design. What is also important, I think, here is to recognize the second commentary in the series saying that, well, just promoting more physical activity is not enough. We also need to be aware about what is the other types of behavior that more physical activity is replacing. So we need to look at it as a whole, as a system. And I think that is probably also the important message that we already heard a little bit about in several of the presentations today is how do we invest in the future in physical activity? And that it's not just one thing. It really, as Alejandra was saying so nicely, we need large-scale, system-oriented strategies across sectors. It's not enough if it's just the health sector investing in more physical activity. We need to grow across sectors. And this document here on the slide is one of the things I think that can be used to help figure out how do we invest in more physical activity. I look forward to hearing the discussion and seeing all the questions coming up. Thank you very much.
Great, thank you. Thank you so much, Jasper, for your reflections. Right, so let's go and see the polls. I know I was only able to give you 30 seconds to a minute to respond, but let's just have a look. So why are you physically active? Well, 75% of you says for health reasons. And, well, first of all, 77% of you says it makes you feel good. Lower down, social reasons only 23%. It's good for the environment, 13.3%, and I'm not physically active, very few percent. So I'd say that's very, that's very encouraging to see our audience take physical activity that seriously. Great, let's go to the next one and see. Do you do the recommended minimum, which of 150 to 300 minutes? 64% of you said yes. Right, that is impressive. 10% say less than the minimum, 17 sometimes, 4.3 and 2.9% never. So again, that's encouraging. But then, as I said at the beginning, perhaps would be expected, given the audience are probably people who do believe in physical activity or work in that area and know the values and benefits it brings to our lives. But still, good to see. Now, if you're unable to be physically active in your daily life, I think this is probably the most interesting of the three questions. Is that because no time too busy? And wow, a staggering percentage of you say 79.6%, which tells you a lot about our lifestyles and modern day living and the fullness and hecticness of it, that we're not able to incorporate some form of activity in our daily lives. Little or no access gets 12.7%, again, indicating, as we heard in the talks, having that enabling environment. You know, a lot of people, especially from low middle income backgrounds or socioeconomic backgrounds, don't have access to safe space to exercise and to move about in, and are also challenged by other constraints, which disables them from being active. Very few of you say you don't enjoy it, and even fewer say you're not bothered or think about it. So, but interesting about being too busy. Thanks very much for that. Let's go on to some of the questions. We've got some great questions in the chat function. I just thought, just to start with, perhaps I could ask the first question to Mel, partly because Mel has been involved in the series, both series now, but has also been an academic in the field for the past decade. I wondered, Mel, if I could start with you and your reflections in the field since the first Lancet series, which was 2012. Where have we seen progress and where has there been less success?
Pam, how much time do we have?
Well, not long. So if you could keep it short, because we've got lots of great questions.
Yes, we do have a lot of progress in my opinion. So if we think about, you know, the multiple domains that we talked about in the first Lancet series, in the surveillance, for example, in 2012, we have about 120 countries where we have data for the prevalence of physical activity, and now we have 170, and that's a huge increase in terms of the data coverage. And we really have to measure in order to know where the problem is and to implement solutions. So I think that is a huge huge improvement. And in terms of our understanding about the health consequences of physical inactivity, we have really moved a lot in this area, in my opinion. So we're now moving beyond the traditional non-communicable disease prevention to understanding the role physical activity plays in immune function. For example, just in the last year, there has been quite a number of excellent studies coming out linking physical activity with COVID-related outcomes. And Andrea just touched on some of them. And also, I think a big progress is now we're officially recommending physical activity to cancer patients. And I think that's a huge progress forward for the field, not only in terms of non-communicable disease prevention, but also in terms of management and therapeutic aspects. In terms of global progress in policies, I think the big one is the WHO Global Action Plan for Physical Activity, because we have an amazing champion in WHO, Fiona Vo, who's really pushing the agenda for physical activity, and I think that's excellent. And also, in the last couple of years, particularly, we have made such improvement in physical activity guidelines. So in terms of the US, the UK, and very recently, the WHO guidelines have really shown the maturity of the field. So now we have specific recommendations, not only for the general population, but also for people living with chronic conditions, pregnant women. So we're really this is really showing that our guidelines have become a lot more inclusive and our knowledge has become a lot more nuanced. So there's a lot of progress that we should be proud of as a field. And I think, a good example would be now physical activity is considered essential activity during lockdown in a lot of countries. And I think without our effort as a community together, this might not have happened. But like what Adrian has mentioned, physical inactivity is a wicked problem, which means it's really embedded in the systems. So really to tackle physical activity at the system level, to really try to get to the main drivers of physical inactivity, it's a very challenging task. It's like climbing uphill or swimming upstream, because we live in a society where the commercial drivers of our life are constantly designing our life to be less active and more sedentary. So we have to do more and better by many times of what we're currently doing to really try to reverse the trend of physical inactivity that we're observing.
Great. Thank you so much, Mel. And if I could just take your last point about the commercial determinants of health and well-being. There's a great question here from Dipesh Gopal in the Q&A, and it ties in with a question I had for you, Adrian, on elite sporting events and the paradox that many sporting events rely on sponsorship by companies that undermine health, such as Coca-Cola and Heineken. Dipesh actually asks, given the role of Coca-Cola in pushing the exercise is medicine narrative in physical activity research, how much corporation influence is there in physical activity research? And then my sort of broader question is there a problem of us trying to promote sport through these elite events and not recognise that the very sponsors of them are simply not interested in health? So it seems like a sort of slight illogicality. Would like to hear your response on that. And then Dipesh asks a last bit of his question is, do the committee think that the physical activity agenda may have been over-egged with respect to weight loss and general health and well-being as a result? So any of the speakers can chip in.
Again, to answer those 15 questions in 20 seconds, Pam. Our approach is a public health approach. What we'd like is an active population and a healthy green Olympic Games. And really, a healthy green Olympic Games means, as Margaret Chan, the WHO former Director General, said, there's no place for big soda, big food or alcohol advertising. And I think that in both research funding and in programs, we really should be independent of these kinds of sponsors if we're promoting a healthy kind of event. We should have responsible advertising in future games. We should have active games for the community as well as for the elite athletes. And to the final question, many of the systems benefits of physical activity are beyond non-communicable disease, and we need to move beyond just obesity, diabetes, and heart disease to the many other benefits, including climate change mitigation of physical activity. So we need to think beyond energy balance in both our sponsorship partnerships, our health focus, and our broad promotion of physical activity in a much wider sense than we have done to date.
Right. Thanks, Adrian. Kathleen, you did want to chip in on the exercise as medicine issue.
Yeah, so speaking from an exercise behavioral science perspective, I think just looking at the results of your poll where we saw that the majority of people exercise for enjoyment just as much, if not more so, than health. And I think the exercise is medicine message, it's almost obliterated that purpose for being physically active. When we try and promote physical activity or exercise in our communities, people just don't like the word exercise, let alone medicine. Certainly, many people exercise for their health, but people exercise or are physically active for many other reasons. And I think in some ways, the exercise is medicine message has done a disservice to those of us trying to promote broader types of physical activity in broader communities.
Yeah, really interesting. So one questions whether a reframing of physical activity is required. Well, yeah, interesting. Thank you.
Thank you so much, Kathleen. We've got some very interesting question, and then that does have Esther's name on it. This question is from the audience, Nicola Marshall. What is currently the best evidence way to support adolescents to become more physically active? Esther, do you have any thoughts to share?
I have no magical insights, I'm afraid. Based on the evidence we looked at, we've identified, the three key factors that I spoke about in my presentation. So although school-based efforts have largely been unsuccessful in a research setting, I think there is some evidence that comprehensive school-based programs that are implemented with a lot of support for the schools and that align with the priorities of the schools and the adolescents themselves actually can be effective. But they require a lot of support, and it is more a systems change at a school level that we would be looking for than just implementing a series of lectures in I don't know, the PE lessons or something like that. So I think there is definitely potential still for school-based approaches, but I think we need to start approaching it differently. The other factor we identified within our reviews is the potential of e-health intervention. That's definitely growing in the adolescent field. It is much larger in the adult literature, but I think that's definitely a way forward where we can consider actually not just complain about the adolescents that they are on their screens so much, but actually also see it as an opportunity to reach them and to engage them in physical activity in a way like we were just discussing, in a way that it matters to them. They probably don't care about their risk of diabetes in 30 years' time, but they do care about having fun with their friends. They do care about doing well at school, those sorts of things. And then lastly, I think thinking about environmental interventions I think is very important for adolescents, that we see that there is a lot of socioeconomic inequalities in access to active environments. However, the natural experimental studies that have been done have predominantly focused on adult populations, so the impact on adult populations, and where children and adolescents have been considered, it is more at the younger age range. So I think there's a huge research gap in our understanding of how changes to urban environments can actually impact adolescent activity behaviours.
Thank you so much, Esther.
Thanks, Esther. I have a question for Kathleen. Why do we need disability-specific evidence about the health benefits of physical activity, Kathleen? Can't we just extrapolate from what we already have learned from the general population?
Oh, that's a great question, Pam. I think there's a common belief that all of our bodies physiologically respond to exercise the exact same way, and that's simply not true, and especially so for people with certain types of physical impairments. So for instance, people with neurological disorders like stroke or Parkinson's disease or spinal cord injury, they often have disruptions to their autonomic nervous systems, and this can alter visceral and immune function, and importantly, it can also blunt the body's cardiometabolic response to physical activity. Similarly, for people with amputations or severely shortened limbs, or who use lower limb prosthetics or crutches, we know that the metabolic demands when they walk those demands are greater than what the general population experiences while walking. So if the physiological response to physical activity is different for people with disabilities, then the amount of activity needed to achieve health benefits may also be different. And I think we also have to keep in mind that even if the physiology is the same, the experiences of people with and without disabilities are not. People with disabilities experience profound healthcare inequities, greater poverty, unemployment, and violence than the general population. And we just don't know how much physical activity it takes to mitigate these social determinants of health. For all these reasons, we need to have disability-specific evidence in order to make conclusive determinations and guidelines about the activity needed to produce health benefits.
Thank you, Kathleen. Good to know that.
Thank you so much, Kathleen. And the next question from our audience is very relevant, and this one is from Aru Shrestha. And this question is about mental health, because I think it's so striking that our audience response really shown physical activity plays an important role in enjoyment, and the word enjoyment has come out quite a few times. And unfortunately, during COVID-19, both physical inactivity and mental health issues have really been, kind of at the center of a lot of the public discussions. And what can we do to integrate the mental health department and the mental health system to work with physical activity promotion? And anyone on the panel can answer that question.
Yeah. Who'd like to?
I can get started. So we know, actually, there is a cross-sectional association between mental health and physical activity. The prospective association, so physical activity actually predicting later mental health in adolescents is actually not very strong. There is stronger evidence for things like screen-based behaviors and later mental health, but then it also really matters what you do while you're on a screen. So if you're mentally active, that seems to actually not be that detrimental for mental health. So I think we do need to do more around thinking about how physical activity fits within the sort of mental health systems. I think the research in physical activity has been too focused on long-term physical health outcomes, and actually thinking about issues around maybe even shorter-term or longer-term mental health across populations. We need to invest more in. There is really good evidence, I think, that actually physical activity can be an effective treatment for depression. That's in adolescents, but also in adults. But in terms of physical activity and its ability to prevent mental health disorders, I think we're still a long way off being very confident that that association is there.
Yeah. Okay.
Anyone else from the panel would add to that?
I just think it's part of the way we need to move beyond chronic diseases, cardiometabolic disease and cancers into new areas of brain health, mental health, and give physical activity a whole range of additional partners and effector agencies. Yeah.
Yeah, I'd agree. I would definitely agree with that. I have, there's a couple more questions here. There's a question here from Matthew Ravella. Now, his question is, in regards to health education with patients in clinical settings, do we have any data on the economic impact of physical activity on the individual? In other words, do we have any data to inform patients and the general population on economic benefits of chronic disease prevention through physical activity?
That was a topic we covered in 2016, right? We're looking at from the healthcare perspective, and since then there has been more economic work in terms of quantifying the economic cost of physical inactivity. And recently, I think in BJSM, that could be last year, and there was a really good comprehensive global analysis on that as well that factors into productivity as well. So there definitely has been increasing amount of work done on the economic cost of physical inactivity, but I think we need more, because at the end of the day, we really need to use the dollar sign to try to make a case for allocating resources and priority setting.
Yeah. Okay.
I have a question for I have a question for either Alejandra or Andreas from. Maybe I'll start with Alejandra. So you showed us really good examples of cities using the pandemic as an opportunity to redesign the city, to kind of implement active travel infrastructures and strategies. I can imagine such changes cannot happen in a vacuum. And in your research, have you encountered any challenges and barriers, obstacles, however you call it, that these cities experience in the process of implementing these changes?
Yes. Well, according to what we were informed, mostly by mayors and by non-governmental organizations, is the fact that in terms of these rapid response that was required for the pop-up cycleways, there was a lack of capacity to respond rapidly. And there was also a lack of funding because, of course, new infrastructure needs funding. In Mexico City, they overcame this challenge by using or recycling other sorts of infrastructure that was used for the Metrobus. But in a more general sense, I think that the number one barrier is priorities for politicians and the acceptance of the public in general of this new infrastructure, because we are used to giving space to cars and shifting or moving this space towards more active mobility is one of the most important challenges for implementing new urban infrastructure. So there's a lot to do, not only in terms of funding and in terms of priorities, but also in terms of convincing people that cycling is a safe, efficient, and fast mobility transportation mode.
Thank you very much. Very informative.
Yeah, great. So I've just been told that I'm now to close our session, sadly. Some really great questions all came up towards the end. I'd just like to say a big thank you to all the speakers and the Lancet team that made this webinar happen. This was our first Lancet Global Series on this platform. So we were all a bit nervous whether it would all go well, and it has. Thanks to the audience for tuning in, staying in, and your engagement, especially as many of us are in this world where we're all on endless Zoom calls daily. So it's very difficult, both with time, to get the time and to have the attention to stick these sorts of webinars on. I think the real plus of our virtual launch, as I could see by who's tuned in today, is that it is truly global. So I guess that's a huge benefit of having a virtual launch over a face-to-face one, which would have probably been in London in a stuffy old university lecture theatre. So there are some positives. So anyway, I'd like to close now. My recommendation now, after 75 minutes of being stationary, is that we should all go and move and have a stretch. Thank you, everyone.